Today's topic is systemic lupus erythematosis. It is a multi-system autoimmune disease in which there is inflammation of different parts of body, which include skin, brain, kidney, joints, and blood cells. Presentation. The various signs and symptoms are remembered by this mnemonic. So, brain empty. S stands for serositis, which include pleuritis and pericarditis, and patient present with chest pain. O stands for oral ulcer, which are multiple and mostly painless. A stands for arthritis. 2 or more than 2 joints are involved, and 90% of the cases present with it. And it is the first sign that brings the patient to seek medical attention. Patient present with joint pain, stiffness, and swelling. P stands for photosensitivity. B stands for blood cells. All blood cells are decreased, leading to hemolytic anemia, thrombocytopenia, lymphopenia, leukopenia. R stands for renal. Patient present with proteinuria and 3+ dipstick test. Red cell cast and hematuria are also present. The most common glomerulonephritis in case of SLE is membranous glomerulonephritis, and it is considered as the end stage of SLE. A stands for anti-nuclear antibodies, which are 95 to 99% positive in SLE patient. I stand for immunological abnormalities. Anti-dsDNA and anti-Smith antibodies are highly sensitive. There is also false positive test for syphilis. N stands for neurological abnormalities, psychosis, seizure, and stroke due to vasculitis. M stands for malar rashes. These are the butterfly rashes on cheek and nose, sparing the nasolabial fold. D stands for discoid rashes. These are red, raised, disc-shaped patches undergoing scaling and scarring. Some additional findings are non-specific fatigue, fever, and weight loss. The patient may have alopecia, mesenteric vasculitis, Raynaud phenomena, and antiphospholipid syndrome. The diagnosis of SLE is based on presence of at least 4 out of 11 signs and symptoms. Now, diagnosis. The diagnosis of SLE is dependent upon signs and symptoms and various antibodies. ANA, anti-nuclear antibodies, which is a screening test and found in 95 to 99% of the cases. If ANA is negative, then it is extremely sensitive for lupus. But if it is positive, then it has little specificity. The level of ANA does not tell us about the severity of the disease. The second antibody is anti-dsDNA antibody, which is 60%, and anti-Smith antibody, which is 35% present in SLE patient. It is extremely specific for SLE and is considered as gold standard test. Also, the complement levels are decreased. C3 or C4 or both are decreased, and it is dropped more in acute disease exacerbation. Anti-SSA and anti-SSB are positive in 10 to 20% in SLE patient. Radiological test. MRI is gold standard for studying brain in lupus. ESR and CRP are also raised. CBC shows anemia, thrombocytopenia, leukopenia, and lymphopenia. Kidney biopsy is done for lupus nephritis, which will show us the severity of the disease. WHO classification of lupus nephritis. Class 1 is minimal mesangial glomerulonephritis. Class 2 is mesangial proliferative lupus nephritis, which respond to corticosteroids. Class 3 include focal proliferative nephritis, which respond to high dose of corticosteroids. Class 4 is diffuse proliferative nephritis, which respond to corticosteroids and immunosuppressant drugs. Class 5 is membranous nephritis, which are characterized by extreme edema and protein loss. And Class 6 is glomerulosclerosis. Treatment is given on the basis of the severity of the disease. If the disease is mild, then sun protection and use of sunscreen is done in order to prevent disease. Anti-malarial drugs, HCQ, that is hydroxychloroquine, is given, steroid is given, NSAID, analgesics, and balizumab. And if the disease is moderate, then steroid prednisone, azathioprine, methotrexate, mycophenolate mofetil is given. In case of severe disease, steroid includes prednisone, methylprednisolone, mycophenolate mofetil, azathioprine, plasmapheresis, IVIG, and rituximab. When acute lupus flare occurs, then high-dose bolus of steroid are given. In case of lupus nephritis, the medication is given in the following way. First, induction therapy, then maintenance therapy, and adjunctive therapy. Induction therapy includes mycophenolate mofetil, cyclophosphamide, methylprednisolone. Maintenance therapy includes MMF, azathioprine, and adjunctive therapy includes SCQ, that is hydroxychloroquine. Young patient dies most commonly due to infection in case of SLE, and old patient die mostly due to accelerated atherosclerosis, which leads to myocardial infarction and death of the patient.